So there is always a very big, there is always a questions about one question is there. Can physiotherapy and robotics recover the functional recovery? And we have to do investigation failures of functional recovery. I made this, I wanted to make it a 44 page slide, but then I will start it with only 8 slides. That may be a conflict of interest. So this slide is presented with not conflict of interest, but with a scientific inquiry. I tell you, it is with a scientific inquiry in which there are certain questions came to our mind and we have answered certain questions. There is no conflict of interest. We never undermine work of physiotherapy. We always appreciate. At the very beginning, I said, I have a high appreciation for physiotherapists. We have so many physiotherapists with us. I work with more than 100 physiotherapists in my life. I have a huge respect for them. There is nowhere we are claiming that this is better, that is not better. Physiotherapy is an accepted subject, but that does not mean we don't change the syllabus. So until unless we understand what is the outcome, what is the failure of the subject, we won't be able to understand what is the new changes we have to bring. Everyone is fascinated with what? Robotics, 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 right? Everyone is fascinated with this new word, right? So when I have written one book, the quantum computing, AI, and with the book, which was appreciated by Baba Khatib. The name of my book is, I sent it in the group. Did anyone see that book? The quantum AI, nanotechnology, predictive neurosurgery, redefining neuroplasticity, neurodegeneration, and neurological innovation. So this is the topic on which I have written the book. It's one of the rarest book. After Baba Khatib, I have written. This type of books are rarely available in the market. So there are very few authors who have written these books. And I'm among the first Indians or among the few Indians to write this book. So in this book, while I was writing, I was writing about the pathways of the brain, the damages inside the brain, and the recovery inside the brain. Right? So whenever we use robotics, active and passive movements, definitely there is some improvement, but the improvement is not a good improvement or a total improvement. What we are looking at about the functional recovery to the 80% of improvement. If the planning is not correct, we cannot reach the definite objective of the subject. You understood? If the planning is not correct, we cannot reach the definite objective. At the very onset, I said there is no conflict of interest. We have only certain questions which we have answered in this slide. These are my own questions, and I am sharing my own failures, right? I am sharing my own failures. It has nothing to do with the syllabus. It has nothing to do with anyone. It is only my own analysis. I have a very huge respect, with very due respect and high gratitude to physiotherapists and their hard work. But even in neurosurgery, we have failures. The outcome is not good always. Similarly, failures and success are the part of the same coin. You have failures in one subject, and after some time, you have success in some subject. So failure and success is like a what? The part of the same subject. Am I right or wrong? So,
Right, sir.
yes. So the most important part is we must understand where do we fail. So this presentation explores the challenges and limitations of combining physiotherapy with robotics in achieving functional recovery. So we have around 45 slides. So I will give you only 8 slides to understand minimum things right now, so that you don't get confused. There's a lot of confusion in the market. You know why this market is totally confused? Because we forgot the fundamentals of recovery. We forgot the first semester of the recovery, that how body recovers. How body embryology we forgot. So when we go higher, the lower subject, which are the base of the medical science, we forget. So when we forget the base of the medical science, when the basics are lost, the higher subjects are also lost. So when we come in between, we have a very good recovery in neurosurgery. We have a very good outcome in ICU. But where is the functional recovery we get? So that is the one thing which I wanted to talk to you, explain to you, and share my understanding and experience with you.
Sir,
हाँ लाडूराम फरवरी। हाँ 4 तारीख के आसपास डेट फिक्स हुआ है। हाँ वही, आज एडवर्टाइजमेंट भी रिलीज कर देंगे हम लोग। आएंगे वही 20 30 40 लोग। आपको ये मद्रास से कुछ लोग आए थे, आपका नंबर दे दिया उनको। यहाँ कुछ लोग आए थे पढ़ने के लिए मद्रास से। मशीन वो KWD नहीं देना, वो दे देना छोटा वो। मेरा तो मैंने बोला है तुमको 80,000 नीडल 90,000 नीडल देना है तो भैया तुम मालिक से बात कर लो, वो तुमको लेने को तैयार है। 70 80 हजार तो भी खरीद रहा हूँ। और तुम्हारा क्रेडिट देने का हिम्मत है तो तुम दे सकता नहीं है तो भैया ये जानो इंस्टीट्यूट जाने। 1.5 महीना का तो ये लोग क्रेडिट लेता ही है। हम्म।
सर
हाँ टेल मी।
सर सर ये कोर्स बना दीजिए ना, वो बहुत लोग डिस्टर्ब कर रहे हैं बीच में।
वाला कहाँ गया? 1 मिनट। वाला। यस काला, आई हैव डन।
ओके
हो
सर।
गया काला।
हाँ जी, हाँ जी।
So there are many things when we see there is a communication between the brain. It was established for a long time, and it was a childhood communication which established the muscle to muscle movement. You start walking in a different way, then in the intelligence is developed, then the eye sensory, the ear sensory, the gustatory, and its integration with the frontal cortex, the occipital integration with the frontal cortex. It is not the brain is working as a divisional part. It is working in division, but it is also working. It's just like a company. You have various divisions for the company, right? You have a company, it's a company. I call it a private limited company, right? What I call it is a private limited
company.
company. You have various departments, but all departments suppose the integration of functions, right? It integrates the department of functions. So there is a finance department, there is a I department, there is a sales department, there is a purchase department, there is this department. But ultimately, the motive of all the departments is to run the what? Company very nicely. So if you want to run the company very nicely, you must understand after rupture or neuromuscular disorder or anything which happens, the pain management, you can do things very nicely, very beautifully, only when you know the limitation. The moment you know the limitations, you know how to overcome it. The moment you know how to overcome it, you know how to win the game. It is all about winning the game. Am I right? It's all about winning the game. So that is why we always proposed integration of NIBS with, again someone is talking. Yeah. Noami, Noami, mute your mic. Noami, mute your mic. So whenever we speak about, see, the most important thing is, can robotics integrate neuroplasticity? There are various questions when we say about neuroplasticity, say internal communication with the brain. Whenever you want to speak about internal communication, the communication which is integrated with the sensory and the motor area has to go to reach the leg. Sensation is there, but the motor conduction is not there. To achieve the motor conduction, you need NCV, you need EMG, you need all the nerve conduction velocity, the amplitudes, the velocity, the electricity transferred from the brain to each muscle. And that part, if we understand, we can understand what is the recovery level of the patient, why the patient did not recover with physiotherapy, and why we are lacking in this subject. Current robotic system often lack the intensity and specificity needed to effectively stimulate the neuroplasticity. That is what I say always. So now you buy escoskeleton and all. See, this is helpful, but you cannot recover the patient with escoskeleton because it does not provide the effective stimulation. That is the first question we must understand, right? Why it does not stimulate? So the most important part we understand is the specificity needed to effectively stimulate the neuroplasticity. So the neuroplasticity is not created. Educate neuroplasticity is not created. What? Educate neuroplasticity is not created. Similar things we find when you give a muscular stimulation, muscular manual exercise. Do you create educate neuroplasticity? That is the biggest question we have, right? The biggest question is educate. Educate means the membrane potential to reach the action potential. So the calcium channels from here, they receive come here and cross the synapse and AP is created. And from here, neural communication starts. So once the neural communication starts with the occipital lobe, the temporal lobe, and with the other guides, and then they go with the corticospinal tract, vertebral tract, right? Am I clear? So, so until the effective stimulation of neuroplasticity is needed, you cannot treat. Repeated movements alone cannot be sufficient to induce significant changes of the neural changes. So that is where the exoskeleton was failure. Exoskeleton means the robot which we use in paraplegia and everything. So we have very much glamour for robotics, right? But did we study the phenomenon of robotics in the neural case? So I am going to write a book, The Failure of Paraplegia with Robotics, the neural communication, failure of paraplegia or quadriplegia and escarskeleton, the failure of neural repair. What we call the failure of neural repair. So this machine was never meant to repair the neural site. It was helped to mobilize the patient, right? That's it. particularly in individuals with severe neurological impairments like spinal cord injury, SCI, partial or temporary. So there is complete disruption of communication between the CNS and PNS. So how robotics can indulge this communication is a question mark. You got my point?
Yes, sir.
Everyone understood what I said? Every foreigner?
Yes, sir.
Foreigners, can you understand my language? Those who are out of
Yes,
India,
sir.
anyone who is not able to understand? Am I speaking too fast?
Okay, sir.
No, sir, it's okay.
Am I speaking too fast?
No, sir. No, sir.
Okay.
It's okay, sir.
Many robotic devices provide minimal sensory feedback. Many robotic devices provide minimal sensory feedback, hindering the brain's ability to learn and adapt. The lack of feedback and can lead to inefficient motor learning. So, what is your goal? Is to make the motor learning. That is the movement, the motor recovery. What is the goal? So, whenever there is a CVA, cerebrovascular accident, whether it is ischemic stroke or it is hemorrhagic stroke, whether rupture or clot or embolism from the heart or DVT, which is because of DVT or anything, right? There is a death of neurons, right? So new pathways are created after the death of neurons with new neurons. That is called neurogenesis, right? So when we speak about this neurogenesis and all, can it adapt to motor learning? And can it induce functional improvement? So there is a very big question which we have. Can robotics apply required membrane potential or it is a glamour? You understood my point?
Yes, sir.
For example, my upper limb is not working.
Hmm.
This is my upper limb, right? It is not working. I have put a robot for this moment. The sensation is to go from here to the CNS. And from CNS, it has to go from here. So we do not know what is the adequate stimulation required to create movement in group of muscles. So each group of muscles has to move, right? Am I clear?
Yes, sir.
Every group of muscles has to move. Then only you have perfect recovery.
Yes, sir.
So when we speak about recovery, what is the role of robotics? Can it generate signals inside the brain? To what level? What amplitude? Can it generate series of signals? Can it help the recovery of individual muscles and united with group of muscles? Right? Am I clear or wrong?
Yes, sir.
So these are the questions we should understand when we speak about robotics. Buying 5 crore rupees of robotics and 3 crores of instruments,
Hmm.
will it really help our clinic? Clinically, that is most important. Glamour is not the importance of the recovery of the subject. We can add any glamour to our hospital, but when we speak about recovery, whether it can really recover, that is most important. Assistance is different. Gait training is different. right? It is training. It is training of the neurons. So the muscles are working here. The pathway is created, but here the pathway is absent. So by giving this repetitive movements, can alone sufficient to induce significant neural changes? This is the first question we have in our mind. You got my point?
Yes, sir.
Secondly, how far it will help you in spasticity? Okay, we can understand flaccidity, right? In flaccidity it works, but what about spasticity? Huh? Can it recover grade 1, grade 2, grade 3, grade 4? If you give active and passive movements continuously, there are chances that it may lead to higher grade spasticity. We have seen the patients who have been continuously using this robotic gloves and all, they have induced to higher level of what?
That's
Spasticity. So whatever we see is not correct. Whatever we see
is not
is
correct.
not correct or totally correct. Whatever we understand is not totally correct. So whatever we study is not totally correct. What we need is to create neuroplasticity inside the brain. The ultimate goal of every treatment is what? To create trillions of synaptic connections. To create trillions of synaptic connections with so that motor movements can achieve. That is the movement of the upper limb and lower limbs. That is called the functional recovery can be achieved. So can it be achieved by this robotics? This is a question mark which we have right now. Robotic protocols often follow a standardized approach. So they don't have personalized approach. These are not tailored approach. These are not tailored approach. So for example, grade 1, same approach. Grade 2, same approach. Flaccid, same approach. So do you have any approaches for anything? Changes? Hemiplegia, same approach. Paraplegia, same approach. Quadriplegia, same approach. Different stages, different, same approach. So they follow a standardized approach failing to account for the individual variations. So now there is a question that individual variations, this individual has a various level of recovery, right? Various level of recovery. You understood? They have various level of
Recovery.
what?
Recovery.
So again, the comes the question whether neuroplasticity and recovery trajectories can happen. This one size fits all the approach and may not be optimized for all the patients. So for all the patients, whatever we have, can this be helpful? But when we speak about NIBS, it helps 80% of the patients.
Wow.
So one side you have a 4 crore rupees of
Machine.
escalatons, 80,000 rupees of robotic gloves. Maybe it is required. I don't say it is not required. 8 lakh rupees of this low robotic device, one person brought to my clinic yesterday. 20 lakh rupees of one more device they brought to my clinic. Is it more important? Are they personalized? Can they propagate the membrane and action potential? Are they tailored? Okay, that means individual approach is there. Now I have 4 categories of CP child. Each CP child can be put in this. I have 5 types of paralysis patient. Can 5 types of paralysis patient be put up here? Huh? Yes or no?
No.
Mm-hmm.
Huh? Yes or no?
I think no.
You are right. You are not thinking. You are saying it is no. Because they have what? Standardized approach. They have a standardized approach. They don't have a tailored approach.
Mm-hmm.
So, for example, you have there are various sizes of the cell, right? You are trying to put 40 to every patient, every person. Now, if I come to your shop, you are trying to put 40. If a much thicker person comes to you, Sachin comes to you, he is having XL size, 42. You are again trying to give him 40. So, everyone who's coming to your shop, you are giving him what?
40.
40. So, is 40 fit for him?
No,
Someone
sir.
is 39,
Yeah.
someone is
42 or 41.
42,
Yes.
someone needs 42, someone needs 43, someone is 44, Imran needs 48 or 52. Can 40, 52 mix up with 40 or 39? Can Imran fit with 39? Imran Mustafa, you have seen a fat guy like elephant.
No, sir. How can it possible?
Can elephant come in 39?
No, sir.
Imran Mustafa, everyone has seen now.
Yes, sir.
So Imran is how much? Is 52. Can you fit him in the size of 39?
No, sir.
Huh?
No,
Now,
sir.
can
How
you fit
can?
me in the size of 52 into 39?
No, sir.
Possible?
No, sir.
No, sir.
This was the question I had. So there is again a problem here, mismatch between therapeutic goals and outcomes. So the therapeutic goal is to achieve MMT by 4, right? Within 2 months, you must achieve quadriceps by 4, adductor by 4, abductor by 4, right? QL by 4. There is a moment recovery. It is called what? Group muscle. First, individual muscle has to recover. Then individual muscle has to associate with the group. Then accessory muscles. So when accessory, individual and group, they become one. Right? You achieve recovery.
Hmm.
Am I clear?
Yes, sir.
You understood what I said?
Yes, sir.
When the individual muscle regains strength, then they get associated with the associated muscles, supported by accessory muscles. When these three becomes one, then proximal muscles becomes one. Then with these proximal muscles, distal muscles has to function. And this functioning has to happen by the brain. So brain has to command the muscles. Each muscle has to be commanded by the brain intelligence,
Brain.
IQ of the brain. So can
Brain.
this be achieved by this? This is called the therapeutic goals and outcomes. Am I clear?
Yes, sir.
Huh? Am I clear?
Yes, sir.
My voice is clear?
Yes, sir.
Can you hear me clearly?
Yes,
Yes, sir.
Can you hear me clearly?
Yes, sir.
yes, sir. We can hear you.
Clearly, clear and loud, sir.
So now the problem is unrealistic expectations. So the most difficult problem here is the patient's unrealistic and the physiotherapist's unrealistic approaches. They have a dreamy world. I call it Alice in Wonderland. What I call it? Alice in Wonderland. There is a story that Alice was a girl who had suffered so many feelings, right? Emotional sufferings. So when she used to go into dream, she used to enter a wonderland where she used to find lot of happiness. So it is called unexpected happiness. It is called what?
Unexpected pains.
Unrealistic expectation. It is called what? Unrealistic.
Unrealistic expectations.
Yes. Many patients and therapists hold overly optimistic expectations about the potential for robotic therapy to rapid functional recovery. This is a question mark because every patient has a different stage, different functional damage inside the brain, right?
Yes.
Different functional damage. Can you understand what I spoke?
Yes, sir.
For example, you have MCA infarct. You had MCA infarct, right? You had MCA infarct. Others may have capsuloganglic hemorrhage, right? So you have gone under manual physiotherapy for a long time. Now you have developed contracture grade 2 spasticity. One is flaccid. So these two can match together. Huh? Did you understand what I said? One is having flaccid, no movement. One is having grade 2. So the physiotherapist always think that by using robotic therapy, achievement of rapid functional recovery can happen because he never makes and CNS with PNS communication. So the absent of the pathway is absent. So they never speak about the corticospinal pathway and vertebral pathway. What do you understand? So this neurological conditions and the individual variability in response to rehabilitation often lead to unrealistic expectations that can negatively impact the patient's motivation and adapt to the therapy. So unrealistic expectations that I have a very big drama school. I have so many equipments and you will recover. It is not. That is why again we came up with what? One theory called non-invasive brain stimulation. This theory is not mine, it is proved by NIH. We only simplified it. What we did? Already in the market. And LBTMS, light transmagnetic stimulation, is already in the market. Am I clear?
Yes, sir.
All these are in the market or not?
Yes, sir.
Yes, sir.
Am I clear?
Yes,
Yes,
sir.
Sure.
The robotic therapy often focuses on improving the specific motor skills and control environment, neglecting the broader functional goals that patient prioritize. So generally when you use hand gloves, it gives active and passive movement of this one. But other muscles, what will you do? Flexor and extensor it gives. But can it unite with the distal and proximal muscles together. So whenever you speak about paralysis, you speak about the group. That is why it is said, Buddham Saranam Gacchami, Dhammam Saranam Gacchami, and Sangam Saranam Gacchami. This is the theory behind this. So first you have to give up your ego, and then you have to take the what? Diksha. That means the revocation of Sang, means the unification. The moment you get unification, you get the knowledge of Dharma. The moment you get the knowledge of Dharma, you know about the Bodhisattva. That is the neuroplasticity of the brain of Buddha. So can this be achieved in this phenomena? The disconnect between the therapeutic targets and patients' real life needs can hinder long-term recovery and impede patients in everyday activities. So again, robotic has one more negative drawback. What it is this? Long-term treatment. So we have seen 25 years patient on paralysis started working with NIBS in 2 months. Where 15 years he was on physiotherapy. I don't blame physiotherapy, but because of the tailored approach, they always do stretching and all. It is very correct. Everything is required. But is it tailored? Can you give stimulation to the brain? Can you give commands to the muscles? So commanding to the muscles, individual muscle, and then uniting with the group is the most important part which we should understand. So this is a second question which came to my mind. You understood what I said?
Yes, sir.
Everyone?
Yes,
Huh?
sir.
So
Yes,
many
sir.
robotic systems lacks the ability to dynamically adjust the treatment parameter based on individual patients' progress and limitations. So after use from SLASIG, he progresses to spasticity number 1, grade 1. So are they fit to tailor that approach? Can they be go with the tailored approach? Yes, certain times we match it, right? Certain equipments they match it, but the cost of the equipment which came was 8 lakh rupees. Now imagine 50,000 rupees and 8 lakh rupees. The robotic SK skeleton in India cost to around 2 crore rupees. The complete one cost to around 5 crore rupees. The better one from Sweden. Because I'm involved in creating robotics in 5 lakh rupees. So what you're getting is from 5 crores, you are making it 5 lakhs in India. You understood?
Yes, sir.
You did not understand what I spoke.
Yes.
Hmm? Did you understand what I spoke?
Yes, sir.
What is a SK skeleton?
Any
एक्सोस्केलेटन इज वन रोबोटिक टाइप सर एक सूट जैसा रहता है जो एक पैच
You're right. It is a robotic structure where you are
Yes, sir.
fixed and the movement is done by the robot, not by you.
Yes, sir.
Right?
Yes, sir.
It is robotized movement. Now,
Yes,
can
sir.
this robotized movement be a tailored? What is the work of treatment to improve the muscle, to bring the neuroplasticity? Ultimately, the goal is what? To bring the.
Neural plasticity.
So, can it create angiogenesis? Can it increase the NCVD? Can it improve the EMG? Can it reduce the great spasticity? So, that is why I say, while working with the CP child, your program should be very good. The recovery should be fast. And if your recovery is not good, the end stage is very bad. So, for example, the 2 years child is CP, right? So, after 8 years, he becomes how much? 10 years. But he behaves like a 2 years child. The gap is how much? 8 years. How will you make up this gap? So now it's 20 years. He's behaving like a child of 3 years. How will you make up a gap of 17 years? Did you understand what I mean?
Yes, sir.
Hello?
Yes, sir. Yes, sir. Oh, sorry.
Neuro Hospital, Hyderabad. न्यूरो हॉस्पिटल हैदराबाद हॉस्पिटल है ये आपको किससे बात करना है कोई नंबर से फोन नहीं आया था अभी हॉस्पिटल So this is a communication. If your communication is not forward, right? If it does not speak a sensible thing, what I will do? I'll disconnect the connection. If anything which is not meaningful to me, not delighting me, it does not give me happiness, what will happen? This one-size-fits-all approach can be insufficient potential and hinders the recovery and creation frustration for the patient who may not be appropriate for such challenge or supported by the robotic system. So robotic system can alone recover a patient, can glamour add beauty to life. Yes, it can add. But can it improve the quality of life? For example, you purchased 10 kgs, 20,000 rupees of what? From airport, a beautiful, what do you call, trolley bag, right? NIBS means what? Giving commands. Commands in form of signals. Brain understands what? Signals. What is NCV? NCV is a signal from the brain. So when you have maps and you put the needle and you put the signal, appropriate signal in appropriate direction, in appropriate manner, what do you receive? NP. Right? You start with membrane potential to reach NP. Am I clear?
Yes, sir.
Yes, sir.
Huh?
Yes, sir.
Yes, sir.
So now you see this is what? Robotic.
Mhm.
This is escalator. Right? This is what? Escalator. And you are given your virtual reality, right? So it is eye-brain coordination and everything. But do you think this will help him to increase the neuroplasticity? So many patients who have recovered by this mechanism. So I always call it a marketing mechanism. Marketing mechanism. It may help. I don't say it may not help. It may help. But to what extent? To what category of patient? Categorization of patients. Help. Whether 5 crore is really worth for buying this equipment. Can cheaper equipments, what we call in India, which is 70,000 or 50,000 equipments, are better? We call it jugaad. The jugaad is better or this is better? So, it's a saying, our Prime Minister of India went to meet American President Joe Biden, right?
Hmm.
So the ambassador was my very good friend who now retired. So the ambassador said a very beautiful sentence. He said, Joe Biden, he briefed Indian Prime Minister about economic technology, everything, right? We want this, we want that, we want nuclear support, we want this support, we want that support, right? American president agreed to everything. But he said, sir, we want only one thing from you. So what? How can I help you? The Prime Minister said, I'm more than happy to give you. He said, I want your Jugaad technology.
That's a nice one. That's really
True,
nice.
sir. True, sir. True.
The Prime Minister of India said, this is the only thing by which India is surviving. If I give you Jugaad, how we Indians will live? So entire equipment, what you are seeing here, this equipment, what we are seeing here, we are trying to convert it into 5 lakh rupees. We are importing, instead of importing the machine from Sweden, we are making it in India. So right now this is given to Indian Army, but shortly we are making for civilians. And I am going to talk to the DG, Director General of DRDO, to make it available for civilians. At least this part we can make it available for civilians. So approximately with this cost we'll get 10 lakh rupees. Now imagine where is 10 lakh, where is 5 crores, right? But where is bronze stem cell therapy? So how will you recover the stem cells? So now the cord is damaged, right? The cord is damaged. Clear? The cells inside the cord is damaged. So they say what? Full injury, right? Transaction injury. What is that? Transaction injury. Am I clear? It is called what? Full injury. So when you have a full injury, the cells of communication, anterior horn cell and other cells, right? Can it transmit signals to the leg? No. So this pathway, corticospinal pathway, and there is a pyramidal pathway and vestibular pathway, can it be improved? Without stem cell therapy? Not possible. Question. How much stem cell therapy will be covered? I do not know. But in 60% of the cases, it has been done. So we saw one patient who have come from Raipur. You can see tomorrow him walking in just 3 days. Now we have to recover only his ankle joint. If his ankle joint is recovered, right? What will happen? If his Achilles tendon is recovered, he can fully walk. And we have not recovered him by any robotic device. No robotic device was used. His neck holding, everything has come in a very good way. Am I clear to you? So I have recovered large number of spinal cord injury patients. And in many cases, I was failure. It was not, I was success in all. I was failure, I was successful. But my success taught me that whether robotics can help, I find question. Am I clear?
Yes, sir.
Huh?
Yes, sir.
Current practices often fall short on adapting rehabilitation protocols to individual needs, leading to the suboptimal outcome and frustration for both patient and therapist. So when we don't have the sufficient outcomes, what will happen? Frustration, giving up approach, lifelong wheelchair, decrease of immunity, atrophy of the muscles, weakness of the muscle. So for example, you are using robotic, right? The entire strength is on what? Robot. Are your muscles functioning? The strength is borne by the whom? Robots. Am I clear? The strength is with whom? Can you hear me?
Yes, sir.
With
The
robot.
strength
Yes,
is
sir.
taken by
Yes,
whom?
sir. Yes.
If you see this picture, the strength is with whom? Do you know
Robot, sir.
anything or not? The strength is with whom? Who's taking the strength?
Robot,
The,
robot.
the robot. So his muscles are functioning. Is his muscle able to bear the weight?
No, sir.
The moment you remove this robot, will he be able to walk?
Not possible, sir.
So how many days will you go for this treatment? So personalized rehabilitation is the only thing which we need to understand. With cognitive, everything has to become stem cells, robotics, physiotherapy. So when everything works together, the recovery becomes
Yes, sir.
but only depending on them. Is a question. Am I clear?
Yes, sir. Who is lining?
So now there is a gap in current methods. There is a limited focus on individual needs and variations of neuroplasticity. This is the most important thing we don't understand. That is why I wrote AI, quantum mechanics. By using the algorithm of quantum mechanics and NCV data, we can calculate how much neuroplasticity has occurred in the brain. So we are developing an algorithm by which we can understand how much neuroplasticity is developed by this mechanism. So that in every case, we can tailor the approach. This is required, this is not required. Lack of standardized protocols for assessing the neuroplasticity in clinical limited. So we don't have the same thing what I said. We don't have assessing the neuroplasticity inside the brain. So, Andheri Nagari Choppat Raja. We are just following what has been taught to us. Insufficient integration of data from multiple sources, including the patient feedback and the performance of metrics. So we make very short studies. Based on the short studies, we try to solve the problem and it is not solved. Am I clear?
Yes, sir. No issue.
The field of neurorehabilitation is continuously is continuously driven advancement in technology and deeper understanding of neuroplasticity. This section develops into innovative approaches to enhance neurorehabilitation outcomes, bringing the gap between the traditional therapies and technological intervention. So we have to develop what? Technical intervention with traditional therapies. Now what syllabus we are following is the same what I saw 20 years back. We have introduced robotics, but without calculation. The robotics we do not have calculated. We only calculated the outcome. We never calculate the NCV data. We never calculated the EMG data, the muscle functioning, weekly data. So all these are what? Option. What they are? Option. A key innovation lies in the development of adaptive robotic system. This responds to the individual patient needs and progress. This system can adjust intensity of movement, pattern feedback, and mechanism. So these things are made right now. Real-time data tailoring rehabilitation to each individual. So they have come up with this. But can I develop NIBS? Can you develop signals inside the brain? Can you give membrane potential? Can sensory inputs improve the muscle input output? Can sensory input improve the muscle output? Can it could release the neurotransmitters? Can neurogenesis, improvement of the neuroadaptive mechanism? The neural communication, the neural repair, all this can happen. The neuropathic changes in the nerve, can all this mechanism happen with this? Because everything is affected. The integration of virtual reality technologies offers immersive and engaging experiences that can improve the patient motivation and engagement. But now it is called occipital law and motor cortex continuation. IN movement. So this has done, it has helped in promoting neuroplasticity, facilitating the skill acquisition, right? It helps it. But what about the spasticity? The question here is again the spasticity. So again we go for Botox. But after Botox again you have a spasticity. So again spasticity, Botox. So can we approach this with this is again a key question. So integration of all. I don't say one will recover all. The integration of all. Integration of all. The further innovation into biofeedback devices that provide patients with real-time sensory feedback on their movements, aiding proportions, motor control. This technology allows individuals to monitor, adjust the performance and promoting self-awareness and enhancing motor learning. So they help you in learning, but the biggest problem what you are learning is what? They are saying learning. I am speaking spasticity. If you are not able to move, what will you learn? You understood what I said?
Yes, sir.
If you can move, you can learn. But if you cannot move, what will you learn?
I am not moving.
Yes,
I am unable to move.
Huh?
I am unable to move.
So if I continuously use these muscles, overuse of these muscles, because this is not tailored approach, right? Or even if you tailor this approach, can it be measure the neuroplasticity of the brain? The communication from ear to ear and ear to ear can be done. So you may approach what? Spasticity to flaccidity to spasticity. From spasticity to the normalcy and neuroplasticity. Can it be accept? Can it be formed?
No, sir.
Until proper signals are given. So that is the reason we need RTMS. But RTMS is again very costly. Light navigation, transmagnetic stimulation, again very costly. So we Indians took out Jugaad. We call it what? Jugaad. This is 50,000, 60,000. This is 5 crores. This is an issue. And licensing fee 2 crores every month. Then treating, then support of the neurologist, all this required in RTMS. It is very good in psychiatry, but so far paralysis is recovered. It does not give again a very symptomatic support of neuroplasticity. How much neuroplasticity can be developed? That's it. Pick. Manual therapy and robotic system offers complementary benefits in neurohabilitation. Manual therapies provide personalized and fine-tuning movements. So whatever we are speaking here is training and movements, right? Training and movements. But if this is not calculative, it leads to spasticity. The moment you lead to spasticity, you go to unrecovered. So this is synergistic approach. A synergetic approach combines the strengthening of both modalities. Therapeutics can use robotics to augment their interventions and targeted measurable quantifiable improvements. Robotics can also assist in therapists in doing this. So this is all helping module, but the most important is spasticity to recovery is a journey which has to be integrated with holistic mechanism, food, diet, proteins, stimulations, manual exercise, robotics, stem cell therapy, Botox, everything is required at initial stage. After some time, when the recovery starts, all this can be withdrawn one by one. And only physiotherapy exercises, acupuncture can help. So generally, I always try to treat a patient for 1 month or 2 months as per his condition, and then I shift it to the people. So here you can see there is a evaluation of impact of robotic assistance. Correct? Okay. But there is, anywhere it is written spasticity. Anywhere it is written spasticity. Anywhere it is written spasticity. Can you overcome spasticity?
No, sir.
Then you have recovered everything, but from this stage, strength to endurance, you encounter what? Spasticity. So that is all what we wanted to say. You may ask your questions. That is why I say NIBS is an important part of recovery of a patient. If you don't know NIBS, you cannot recover patients. You're just doing like either you have to go for replacement surgeries, or you have to go for painkillers, or you have to go for acupuncture called NACID. NACID acupuncture. NACID means non-steroidal anti-inflammatory drug, means you treat, you don't recover. It is just like a painkiller therapy. So if anyone speaks about 1 needle therapy, 2 needle therapy, this is not, because the muscles have to improve, the nerve have to improve, the enkephalins and the endorphins, whatever is required to recover the patient, it has to improve. You must know the actual diagnosis, whether the ligament is damaged, what is required has to be done. You just cannot do anything. For example, if you put these patients on high robotic and the ligaments are damaged on the leg, what will happen? The ligaments will continuously damage. And at the end of the day, even they have achieved movements, their knee cannot hold the strength because ligaments and everything is damaged. So you have to be very careful, very well trained, very well understood what has to be done in recovery of the patient. Am I clear?
Yes, sir.
These 7 slides are equivalent to around 200 pages. So 200 pages I finished in how many? How many
20.
hours?
7 slides in 1 hour.
I don't think so. I took 1 hour also.
Yes, sir.
Now you said acupuncture. Tell me which acupuncture point can recover paralysis. Tell me the name of acupuncture point. Which kind of paralysis you want to recover? MCA, PCA. What is the brain area which is damaged? This is the basic thing I'm asking from the first day. Which brain area is damaged? How many sessions? Right? We don't know. You are saying paralysis is a local mechanism. Paralysis is not a local, it is a CNS, brain damage. So how can you say about local recovery? The question is very simple. Where is the damage in the brain? Where is the damage in the pathway? So how can you recover it in the way you want?
No, sir.
Pain is a damage.
Yes.
So without diagnosis, how can you recover? You are just doing whatever you want. You are not recovering the patient.
Yes, sir.
Neither you are referring nor you are recovering. So what you are doing? You are just doing time pass. And that is what it is written. When you do time pass, you get frustrated and patient gets frustrated. And that is why your motivation is low, so low. On the other day, I was learning why Manish Gala is thinking so much about pain. I asked him a question. He said, how can I take the risk? That means his motivation is low. Why his motivation is low? Because he has felt so much failures. His clinical outcome was not successful. When I go to Sunil, the moment I speak that I found out a new pain, the first order comes from Sunil. Right? His motivation is high because he has recovered a bacillary artery infarct. The question is simple: what you want and what you get, and what you are thinking. Can you see me?
Yes, sir.
Yes, sir.
Yes, sir.
Yes, sir.
The board is gone, so I am in without the board.
Yes, sir. Board is gone.
Yeah. It is connecting.
No, sir.
So I don't know how to connect. It is Sandeep who connects it. So Sandeep is not there. Anyway, class is over. You can only ask a question. So when you ask me a question, don't ask me how many sessions it will require, what it will require. Whatever has to require, it will require. How many rotis you will eat, how will I know? So if you are using robotics, you are continue using physiotherapy without calculation, your subject is failure. You don't know how to recover the muscles, how to put strength on the muscles, how to divert the strength, how to balance the strength of the knee. Your osteoarthritis will continue to recover. Even after replacement, we have seen the patient is having high pain. So what will you do? What will you do? Can you recover a patient?
No, sir.
Then? So what it is? Drama. So you can ask me questions. Any questions for today? Akash, can I see you? What is your face? Akash Samantha?
Yes, sir.
Open your cam. Let me see your face. You have closed your cam. So my eyes is not visible to your face. Optimize your cam so that I can see you. वाकरे जी कहाँ चले गए?
है ना सर, है ना। है सर, सिर्फ कैमरा
चेहरा
बंद
नहीं
है।
दिखाई दे रहा है.
यस सर, 2 मिनट सर।
सब टी शर्ट गंजी में बैठ के क्लास में आ रहे हैं. हाँ आकाश, आई कैनॉट सी यू. हाँ सब वो क्या बोलते हैं ना, गंजी में बैठ के आराम से क्लास अटेंड कर रहे हैं. शकील, हाँ नाउ आई कैन सी आकाश समंता. वेरी गुड. शकील, आई कैनॉट सी यू. वाकरे जी आप समझ गए होंगे मैं क्या बोल रहा हूँ.
बिल्कुल सर, समझ गए सर। शकील जी
इनका
आज है।
हाँ इनका बायोडाटा ले लो.
फोटो निकाल लिया।
फोटो निकाल दो, बायोडाटा ले लो. In our class, whoever young boy comes, we find a girl for him. The dowry demand is 2 crore rupees. 20% is mine. So, Akash, are you married or unmarried?
Sir, married.
So we will name this class as what? Old age home
Old
or
age
second
home.
hand mall. Yes. All are old people, 2 or 3 young people are coming. So this class name is old age home. No new people or second hand mall, second hand car. No value of the car. I have Mercedes. I purchased in 56 lakhs. Now it is not even 2 lakhs Mercedes. What I will do? Even you have come to me 20 years back, I would have won a lot of money. But you also have become old. Samantha, Liu, Sakil, all are old people. Sakil तो भाग गया लगता है. Sakil? भाग गया ना शकील?
है सर, है सर.
निकालो कैमरा. There is a matrimonial society going on at the end of the class. All young boys, their photo will be taken. We will put on work race. संजीव कैमरा खोलो. हाँ, ठीक से चेहरा दिखाओ. तुम्हारा कैसा काला कलर का चेहरा आ रहा, कोई लड़की भी नहीं मिलेगा. We want some handsome boys. आकाश थोड़ा लेट कर दिया, नहीं तो 2-3 करोड़ का फायदा हो जाता हम लोग. 5-6 का शादी कर देता, हम लोग का बुढ़ापा आराम से निकल जाता. वाकरे जी का मेरा बुढ़ापा आराम से निकल जाता. So anyway, we have explained you why physiotherapy is not enough to recover paralysis, why acupuncture is not enough. Because in acupuncture you get training. So overall, everything is required to recover a patient. It is not one mechanism or two mechanisms that can recover a patient. Acupuncture is important. Neuroacupuncture, selection of point, dermatome, myotome, brain stimulation, and the recovery is faster. Otherwise, ठन गोपाल. अल्लाह जाने, अल्लाह का रसूल जाने. मैं तो नहीं बोल सकता कब ठीक होगा. Okay? Everything clear? I hope you understood what I meant. रविंद्र मेसारा मैडम सोया हुआ है, देखो क्लास में. क्लास में उसका बाप का घर है.
सर वो नहीं है, मेरे फीवर आया है.
और क्या?
टाइफाइड
9 बजे
फीवर आ
आके
गया.
सो गया. 9 बजे आके सो गया क्लास में. हाँ
सर सोया नहीं हूँ मैं.
अरे
मैं लेक्चर सुनी.
हाँ, लेक्चर
सुन रहा
सुन के
हूँ
सोए
मैं.
डाल ले. तेरा बाप नोट लिखेगा. हाँ
सर टाइफाइड फीवर था, इसकी वजह से मैं थोड़ा सा
अच्छा
लेट
अच्छा,
गया
टाइफाइड हो रखा था. चलो ठीक है, आराम करो.
जी
कोई
जी
एंटीबायोटिक लिख
जी सर.
देंगे, खा लो, इंजेक्शन
जी
लगाओ और
सर.
सो जाओ. वाइटल टेस्ट किया?
हाँ सर, विडल
वाइटल
टेस्ट
में
किया.
क्या पॉजिटिव आया?
जी सर, जी सर.
आवाज से भी वो डाउन लग रहा है. थोड़ा रेस्ट करो, थोड़ा आराम करो, ठीक हो जाएगा.
थोड़ा सा
एंटीबायोटिक से सब ठीक से लो. लेवोफ्लॉक्सासिन ये सब लो, ठीक हो जाएगा.
ये लिया सर, ड्रिप्स
कौन
में
सा
लिया है.
एंटीबायोटिक ले रहा है? कौन सा लिया है अभी
सिपोडा
एंटीबायोटिक?
सिपोडक्जिम डाला था सर.
सेप्रोडक्सिन लिया, ठीक है. प्रोबायोटिक लेते रहना, ये तो गट
जी
इन्फेक्शन हो जाएगा.
जी सर.
प्रोबायोटिक ट्वाइस ए डे, विटामिन एंड ये क्या बोलता है, ये एंटीबायोटिक कंटिन्यू. हाँ, थोड़ा रेस्ट करो, थोड़ा जल्दी ठीक हो जाएगा.
जी
ओके
सर. ओके सर.
चलो ठीक है भाई. रविंद्र मेसाराम को टाइफाइड हो गया, आप लोगों को भी टाइफाइड हो जाएगा, कंटेजिनियस है, इसलिए ओम शांति. थैंक यू सो मच.
थैंक यू सर. थैंक यू.
थैंक यू सो मच.
Thank you, sir. Gratitude.
Thank you, sir. Thank you very much. Good night,
Thank
sir.
you,
Thank you.
sir.
Thank you so much.
Thank you very much.
Sir.